Good morning. Good morning. I am live from the Philippines. It's a wonderful winning Wednesday or Thursday, and we are going to talk about the very must know Acne Vulgaris. So you can hear the music in the background probably. It is the time of elections, and so you got to know who you're voting for here. I am in CDO. People are like, my people are asleep. Yes, no, it is a beautiful day. And it's such a pleasure to be with you. We have a lot to do. Whether you are starting your journey for NCLEX or you are about to take your exam this week, showing up and being consistent in your studying is such a great help to you. Once you get your license, you will find that the little bit of suffering that you had to do to be consistent, to sacrifice, to stay up late or wake up early, it will all be worth it. Now, do me a big favor. Let me know in the comments where you're from. Let me know in the comments where and what part of the world you are representing. I like to see it. And also, don't forget, the reason why I'm here in the Philippines is because I have an amazing partnership with NCLEX Unlimited, and we are working together to make sure that the nurses here in the beautiful island of the Philippines have access to the books, the program. I see it. I love it. And that you're passing your NCLEX as quickly as possible. That is the goal. So I see I have USA representing, Nigeria. It's a pleasure. Puerto Rico, welcome. Honduras, all right. So as ReMar nurses, as we're a global community, we have a responsibility not only to learn, but also to learn and share. So we have some amazing opportunities for learning here. Guess what? In the United States, Nurses Week is coming up next month. Nurses Week is coming up next month. And so during Nurses Week, we will be going full out with prizes, study sessions, products, everything to celebrate the hard work of the nurses in the United States. So you don't want to miss that. Nurses Week, we'll be doing reviews. It's coming up. I'm really excited about that. Also, graduation time is happening, and we do ReMar Nurse University every Monday in June. And so we'll be focusing on pharmacology. It is not too early to sign up for ReMar Nurse University. It's simply remarnurse.com/RNU. There you go. I look well rested. Thank you so much. I am getting lots of sleep during plane traveling that I'm doing. Also, if you are intending on being a nurse, just getting your nursing license is not the only thing that you need to do. You also need to plan where you're going to work, where you're going to be practicing, because once you get your USRN, you're able to travel, you're able to do many things, okay? Many things. So we also have our partnership with Safe Nurse Now. This is about a career that puts you first. And so you can find out the jobs that we have by going to remarnurse.com/jobs, and they will show all of the amazing travel opportunities that ReMar Nurse is currently delivering to you. So we got a couple nurses working in travel nursing right now, and it's just so good to see them being able to grow professionally. And I want that for you too as well. So the travel nurse boot camp that we have takes place on Wednesdays at 7 p.m. Eastern Standard Time. You can keep it right here locked to see those travel nurse opportunities. So shall we get started? Shall we get started with our class today on acne? And you may be wondering, acne vulgaris, why is acne on the NCLEX? Why is acne on the NCLEX? Can anybody put in the comments why you would expect to see a situation with a patient with acne? What is the concern? Because when we talk about NCLEX, we are typically talking about acute care. We are talking about emergencies. So what place does acne have Is it just your face only? What place does acne have in the conversation for NCLEX? Oh, I see it. I see it. So here are some of the great comments from the international nurses here. And I myself right now I'm an international nurse. I love it, right? Common in adolescence. That's good. Yes, we have to address the medication interactions. It does affect the face. Why is acne on the NCLEX? Self-image. Good job. This is it. This is it. Great job. So we're going to be talking about the specific points about acne, because remember, you're not trying to study everything. You don't need to study everything, just the major safety points about certain topics. Okay, so Acne Vulgaris actually comes from the V2 student workbook. So I asked this question: why is acne on NCLEX? The answer is because acne is not just a skin issue. Okay, it's not just a skin issue. It is a mental health. Ooh, watch that. Did you catch that? It's a mental health and medication safety issue too. That's why this is on the NCLEX. It's so much bigger than just a surface skin problem. Okay, it's a mental health concern. There's medications. All right, awesome. Nurse Patel says, hey, I passed my NCLEX last weekend. It was a good weekend. Your videos were a great help to me. Thanks. Isn't it good to be able to finally say, I have passed the NCLEX. Now I'm a nurse. So good. Congratulations. Congratulations. I want that for everybody. So in the V2 course, I do go over the medication that we're going to be talking about today. And it is part of, oh man, it's coming to me. It is part of developmental, not developmental mind. Y'all help me, okay? The days and the nights are running together, but it's part of age-specific care. There it is, age-specific care. So we talk about this with teenagers, right? Okay, so let's get into it more. So acne vulgaris, what we are dealing with a chronic and reoccurring condition. You have open and closed comedones. You have papules, pustules, and nodules, and these can appear on the face, the neck, the trunk, and proximal upper extremities. All right. So patients who have this, we have to tell them, you may have this for quite some time. This is not something that may go away in just a few weeks. Okay. So imagine our teenagers. Remember, teenagers are in the place where, hey, the way that you look is your social status. And so when this happens, it can be very devastating. It can be very devastating. So what are the risk factors? Why does this happen to some people, but not everybody? Well, it is a genetic predisposition. Okay. Patients who have endocrine disorders, polycystic ovary syndrome, they may experience this more than others. Dietary. So we know that there are some inflammatory foods that will make this condition worse. Dairy, you have your high glycemic load. So you have those, those processed foods. Also, skin trauma. When patients begin to become overzealous about getting rid of the acne, they can damage their skin and make it actually worse, especially if it's a bacterial cause of this acne. It makes it worse. And then the stress. Teenagers who are stressing about their skin and what it looks like can also make the acne worse. And then, of course, insulin resistance. If a patient has that, it will make increased oil production in the face. And when we talk about acne, what part of the skin is affected? What part of the skin? And this is something that you should know. It is the hair follicles. That is where the issue is. Okay. And so you have different types of acne. We know that acne is like autism in a sense that it is a spectrum. So you can have a patient with acne and they just have, they just have the comedones. It is not inflammatory at all. Okay, it's not. And then we have patients who have inflammatory acne. This comes from what I'm talking about comes from the V2 workbook. Okay, the V2 student workbook. Okay, and so when I was going through that, I saw this topic, and I'm like, let me dive a little bit more into this. Okay, and so I have here Cutibacterium acnes, and this is the bacteria that naturally lives on your skin. So it's on my skin, it's on your skin, and it feeds hair follicles. It feeds on the hair follicles, okay? The oil there, the oil in your skin, it loves it, loves it, loves it. Well, when you have too much of this bacteria, it can trigger, okay? It can trigger inflammation. And this is what leads to that inflammatory acne. And you have pimples and pustules, and more importantly, cysts, which can be really painful to a patient. Okay. All right. So just really quickly, now that we have the pathophysiology of acne down, let's talk about the treatment. And this is one of the big things for NCLEX. So the treatment that you're going to hear most about is isotretinoin. This is a retinoid that is used to treat acne. Okay. Now you can have things like topical treatments, and you can have things like systemic treatments. And then also there can be surgery that can be done as more like, extreme facials and things like that. But for NCLEX, isotretinoin, benzoyl peroxide are going to be your go-tos that you must know. So let's break those down. So the two medications that you want to know, I want you to write these down. Take some time and write these down. Okay, I'm giving you a moment so that you could be compliant. I see Amanda's testing soon. So Amanda, we do want to say blessings to you. Thank you so much for, making it to this point. Choosing that test date is very important. Now you have a goal that you must finish. Okay. All right. So let's start with the isotretinoin. This is one that I talk about in the V2 lectures. So what I want you to add to the things that I said in the lectures is this. This is used for severe cystic acne only. This is a last step. This is a last method. You don't use this until you have tried almost everything else and that didn't work. One of the reasons why you don't use this is because, it's highly teratogenic, meaning that it can cause severe birth defects. So women who choose to be on this, who are in their fertility period, have to be on 2 forms of birth control. Yes. And they should get monthly pregnancy tests to determine that they are not pregnant. Another thing about isotretinoin as a retinoid is that you need to have your liver and your cholesterol monitored while on this medication. So, is this a lot of teaching to tell a young person or a younger age person, even somebody into their 20s? Yes, absolutely. This requires lifestyle change. Now, yes, you know this, right? So let me critically position you to think. What vitamin is isotretinoin most chemically identical to? For this to be a retinoid, there's something special about this. It's the way that it is built. It is most identical to which vitamin? And this is why we have to tell the patients that they need to avoid taking this vitamin at the same time as isotretinoin. I see it in the comments. Great job. Great job. It is absolutely vitamin A. So this medication can cause a vitamin A overdose. Good job, Lourdes. Good job. Great job. Okay. So critically thinking, before you give this medication, you have to tell your patient this. Now, let me press you a little bit more. Why would isotretinoin require liver and blood monitoring? It's a very simple principle. Why would we need to give blood monitoring for this condition? Why is it necessary? And we know that it can cause liver issues and it can cause cholesterol issues. But why is that? Why? What makes it? Why do we have to make that leap and that connection? Causes inflammation, hepatotoxicity. Okay. Well, when you think about acne medications, when a patient, let me walk you through it. When a patient goes into the store and they begin to have acne, what type of medications are they going to choose? What are going to be the easiest types of medications for a teenager with acne to go and buy? What do you think? When you go into the store and you're picking up something for acne, exactly. Okay. Exactly. So it's going to be topical medications. Now, here's the question. Is isotretinoin a topical medication? Can you go in to the store and get this as a lotion or a skin cream? No, you can't. And so you have to use this medication as an oral medication. So that means that this medication is going to encounter the entire body. This is very important for you to know. This is what makes isotretinoin a teratogenic medication, is because it's oral, not because it's topical. Okay? So don't miss that when we're talking about it, because that there's different implications for that. It's an oral medication. Yes. All right. Then so what is the pregnancy safe medication? Because we always have to think about that. If you can't give something to somebody who's pregnant, what can you give them? So I want you to know this, and this is in addition to this is what you're writing down. You're taking notes today. Benzoyl peroxide is what you can give for acne in pregnant situations. However, benzoyl peroxide is very strong as well. And so you can only put this on your skin. And the reason why people don't like this medication is because it's so strong that it can bleach everything. Like it's like a very strong cleaning agent. So it bleaches out your hair. It can change your hair colors. It can change your clothes, especially if you have dark color clothes on. It will take the color off of your clothes, your bedding and everything. So you have to warn patients that if you don't want your things destroyed, you either wear all white, because if it comes in contact with the color, it will turn it white. So you have to start wearing all white. Or when you put it on your skin, you have to make sure it's completely dry before you get dressed. Yes. This medication, like most medications, takes 4 to 6 weeks to work. So I just want you to be prepared if you get any kind of question on benzoyl peroxide, that you are prepared for the teaching portions of it. Yes. Nothing I say to you is to waste your time. All right. So again, when we talk about this management, if you are doing a retinoid like tretinoin, or not isotretinoin, but tretinoin, you're going to be doing the liver function test. You're going to tell patients to do it at night, wash their face for 20 minutes to apply. Acne will get worse during the first month, and do not use during pregnancy. All right. When we talk about how we treat these acne, mild acne, typically you're just doing a topical medication and oral antibiotics, because some bacteria, like I said, the inflammatory bacteria is acne is caused by bacteria. Moderate acne, oral antibiotics, contraceptives, and spironolactone can also be used, all right, as a treatment. And then severe acne, you have isotretinoin. You can have some, it's called intralesional injections, where they actually inject medications into your skin, and the laser dermabrasion. And this is, a very specific type of facial that you get. Our client education is simple. We know that this is a recurrent chronic condition, so we want to prevent it and stop the reoccurrence from happening. All right, and pick the best treatments. So we're going to get into some NCLEX questions based on this content, and it is to help you think. But before I go, I also want to talk about the mental health issue that acne is, because acne can cause depression in patients, especially our teenage patients who have this condition. So isolation can occur, suicidal ideation can occur. And so as nurses, we also have to be able to understand the limitations of medical treatment and when we need to bring in the psychosocial support for these patients. Okay. So acne, why is it on the NCLEX? Because it is a very serious condition. It's a very serious condition. All right. So as we are coming to the study sessions and we are being consistent with the calendar, we need to remember that the best thing for you to do is to make sure before you sit for NCLEX, you have done every part of the V2 program. I'm not just talking about just doing the quick facts. That is something that I'm running into, people just using quick facts, and then they say, well, I didn't pass NCLEX. Let me just be very honest with you. Quick facts is just half of the program. Most people are not just learners of one way. Can you read? Absolutely. Everybody can pick up a book and read. But what helps comprehension is usually an audio-visual tool. Audio-visual. So don't neglect adding the video series to your studying, because that usually helps to tie in the big points that are missing. All right. It has taken me more than 3 months to get through V2. That's fine. That's all right. Okay. Everybody is learning at a different level. Everybody is starting at a different level. You have your strengths, you have your weaknesses, and that's okay. The most important part is that you are doing the training. You're doing the training that you need, not what anybody else is doing. You're not competing with anybody when it comes to getting prepared for NCLEX. You're not competing. You're completing your journey. That's what you're doing. All right. So let's do some specific critical thinking questions about how we are approaching this topic of acne. Here's the first question. Let me read it to you. A 17-year-old client with severe acne has been prescribed isotretinoin. Which nursing action takes highest priority? Is it number 1, educate the client about avoiding sun exposure? 2, discuss dietary sources of vitamin A? 3, assess for signs of depression or suicidal ideation? Or 4, instruct the client to use 2 forms of birth control? This is a good one. And I see multiple answers on the screen, and I love when that happens because that means that learning will take place here. Correct answer, you got it if you chose number 3, assess for signs of depression or suicidal ideation. All right. So from the choices that you were given here, mental health safety was the priority here. And it's not that the other ones were okay. It's that the other ones were also right. They just were not the priority. Okay. Yes. So that mental health, suicidal ideation, way more important than vitamin sources of A, way more important than 2 forms of birth control, way more important right now than avoiding sun exposure. Okay. So you got to be careful. All right. Any questions about this one? All right. Let's go to the next one then. Question number 2 is this. A client with acne vulgaris tells the nurse, I don't want to go to school anymore. Everyone stares at me. What is the nurse's best response? Number 1, you should try not to worry about what others think. 2, have you thought about talking to a school counselor? 3, would you like to show would you like me to show you how to cover the acne? Or 4, you know acne goes away with time, right? Okay, which one are we going to pick in this situation? Great job. It's Wednesday night somewhere. It's Thursday morning somewhere else. Doesn't matter the time. All that matters is that you show up for yourself to these study sessions. Correct answer here. Let's dive into it. Critical thinking. It is number 2. Did you pick this one? Have you thought about talking to a school counselor? Because we know that this client is showing signs of some distress. They don't want to go to school anymore. And so as nurses, we have to know that our limitations can be picked up by someone else who is also a health professional. So we would definitely want to refer the patient to maybe talking to someone in their space that can help them. All right. Let's go on. How about this one? A nurse is teaching a teenage client how to manage mild acne with over-the-counter treatments on her own. Which goal is the highest priority for this client? Number 1, demonstrate how to apply several different products correctly. 2, demonstrate how to read ingredients lists. 3, identify signs of medication overuse or irritation. Or 4, express realistic expectations about acne treatment timelines. These are all great. These are all great. But again, I'm not asking you what's right. I'm asking you what's the highest priority. That's different. That is different. So this is critical thinking. If you're getting through these questions and you feel comfortable, you may be ready for NCLEX. Are you ready for NCLEX? Sooner than you think. And I'll say honestly, most of you are wasting time trying to feel like you're ready. You might not feel like you're ready. You might just need to go and take it. All right. And believe that you are. Correct answer, number 3. Identify signs of medication overuse or irritation. This is going to be the very best thing. Let me just read the rationale. It says, let me go back to it. Medication overuse. This teenager is managing this condition on their own. Okay. So medication overuse, trying to be too aggressive, can lead to chemical burns from these materials, these chemicals, allergic reactions, and even serious skin damage. Okay. That will be worse than the actual acne. So we want to be able to teach our patients how to identify not overdoing it when it comes to the medications. All right. Ready for the next question? Let's go. Okay, here's this scenario. A 19-year-old client calls the nurse and reports she is 6 weeks pregnant. She has been taking isotretinoin daily for the past month and is now concerned about the impact on her baby. What is the nurse's priority action? Number 1, instruct the client to immediately stop taking isotretinoin and flush the remaining pills. 2, schedule an appointment with the maternal fetal medicine specialist. 3, notify the healthcare provider and initiate a teratogenic exposure protocol. Or 4, reassure the client that most early pregnancies are healthy. What should we have the nurse to do in this situation? Okay. The correct answer here is number 3. Notify the healthcare provider and initiate that teratogenic exposure protocol. This is what the nurse is able to do. We cannot have the patient or tell the patient to immediately stop taking the medication. We don't have the power to do this. Do you know why in this situation we don't have the power to do that? And it is one of the reasons why you have to pay attention to every detail on the NCLEX. Is because this 19-year-old is calling in. They're calling in on the phone. So we as nurses, we have to prioritize establishing a safety protocol. Okay? And that would be getting the healthcare provider involved. That's what we have to do when we are doing this virtual nursing. Okay? All these things matter. And I'm so glad in the comments, I see you happy. I see you celebrating. I see you feeling good because yes, indeed. Yes, indeed. As part of the journey, our classes and watching me on Mondays at noon and winning Wednesdays. Okay, I just have winning, just winning that takes place on Wednesdays at 9 p.m. Eastern Standard Time. It does pay off. It does pay off. And it's part of you building up your confidence, building up your resilience to just go ahead and take that test. That's it. Okay. By the time I come back to the USA, you should have a test date scheduled. If you can. All right. So thank you guys so much. I am ready to start my day. I'm headed to Davao, and I am looking forward to one more masterclass here in the Philippines. Sarah says this is also winning. Praise God, I passed my PN exam on April the 2nd, studied for 70 days with a 2 weeks old baby. Yay! A 3 and a 5-year-old. Woo! Out of school for 13 years. If not for God and ReMar and her team, this wouldn't be possible. Oh, how beautiful is this? How beautiful is this? And it just kept getting better and better as I read it, you know, giving God the glory first. And then she went on a 70-day journey with ReMar. 70 days. Oh, man, that's pretty quick, actually. And then with the 2-week-old baby, but not just the 2-week-old baby, because that means you're not sleeping. That means you're feeding the baby every 2 to 3 hours. That means you rocking the baby in between the lectures. That means you waiting for the umbilical cord to fall off. Come on, mothers know this. That means you might be dealing with some eczema, trying to figure out what to put on the baby's skin. And you got all your attention here. And then you got a 3-year-old. 3-year-olds potty training. They want to play. 5-year-olds, they want to do ABCs. They want to write. This is a mother. Y'all know when you're a mother, you don't have time for yourself, just your own physical self. When you're a postpartum mother, come on. And so you had to make time for your physical healing and your mental healing and also your education. So this deserves, honestly, a standing ovation for what you have accomplished. And now just the life that you can give those 3 kids, it's going to be different. It's going to look different. Mommy has done the job. Mommy has done it. And so congratulations. I'm so proud of you. Three kids is the it's the most challenging number of kids to have. And this is coming from a mother who has 4 kids, but 3, and you have 3 under 5, 3, 5 and under. Mind blowing. So this is definitely winning Wednesday, right? And whatever excuses that you started this broadcast with, let them go. Okay. Let them go, because there are nurses who are in your situation who are getting it done. Okay. They're getting it done. And I want you to have the same thing. Get in there. Woo. Training. Get the training. ReMar V2. This episode is brought to you by the program that I really poured my heart into so that nurses all over can have access to the technology, access to the materials, and then a pathway. Okay. So takeaway is this. If your dream does not have a date to it, If you don't have a date to when you are taking the NCLEX, it's just a dream still, okay? When you put a date to that dream, then it becomes your goal. Then that's a goal, okay? And so even if you don't have your ATT, give me a month. Give me a July 2025. Give me a June 2025. Oh, you got my mom's birthday, April 29th, 2025. My mom's birthday is that day. Okay? So I will be celebrating that day. Okay? All right. So as I leave, I just want to thank you for showing up for yourself today. I want you to spread the word about ReMar. Invite somebody. Invite somebody to our study sessions and let them know all the great things we are doing here. Our mission is to not help you just get a license, but honestly build a legacy. And Nurse Sarah today, by getting her license, will be able to pass all of her success down to her children, change the next generation, and also improve nursing globally. So thank you, everyone. Have a good day. I'll see you on Monday. Bye.